Diabetes mellitus is a disease that affects the pancreas and related hormones, mainly insulin. There are two main categories of diabetes mellitus, type 1 and type 2 diabetes. Type 1 diabetes is the result of a decrease or absence of insulin production by the pancreas related to autoimmune pancreatic B-cell destruction. This destruction consists of interactions between environmental factors, genetic depositions, and autoantigens. The destruction of the B cells may take place over months or years until a point is reached where insulin production can no longer adequately control blood glucose levels. Type 2 diabetes is a result of resistance to insulin that eventually leads to a decrease in insulin production. Hepatic insulin resistance leads to an inability to suppress hepatic glucose production, and peripheral insulin resistance impairs peripheral glucose uptake. Obesity and weight gain are important determinants of insulin resistance in type 2 diabetes. They have some genetic determinants but also reflect diet, exercise, and lifestyle. An inability to suppress lipolysis in adipose tissue increases plasma levels of free fatty acids that may impair insulin-stimulated glucose transport and muscle glycogen synthase activity. The diagnosis of diabetes mellitus is usually accomplished by regular testing and precautionary lab work. The hemoglobin A1C is used to diagnose, and a level greater or equal to 6.5% indicates diabetes. Prolonged hyperglycemia as a result of late diagnosis can result in diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy in small vessels. In large vessels, it can result in angina pectoris and myocardial infarctions, transient ischemic attacks and strokes, and peripheral arterial disease. Controlling diabetes mellitus is a serious matter, and the patient should always consult their medical provider. Type 1 is usually controlled by insulin, and type 2 can be controlled by insulins or oral antihyperglycemics, or a combination of the two. Diabetes is a disease that affects your pancreas and the hormones it produces. There are two types of diabetes, type 1 and type 2. Type 1 diabetes happens when your pancreas can't produce enough insulin to keep your blood sugar under control. Your pancreas may not be producing enough insulin because your family has a history of this disease, or you came in contact with something in the environment that causes cells in your body to develop this disease. Type 2 diabetes happens when your body cannot properly use the insulin it is producing. Being overweight and eating unhealthy have a huge impact on whether you develop the disease or not. It is very important to go to all your regular checkups with your doctor to make sure that you know if you have the disease. A blood test can be done to show you whether or not you have diabetes. Getting diagnosed late increases your chances of having more complications related to diabetes. Loss of sensation in lower extremities, kidney disease, and a decrease in eyesight are just some of the things that can happen when your blood sugar is too high for too long. You may also be at any increased risk for heart attacks and strokes. It is important to talk to your doctor about controlling your diabetes with medicine or lifestyle changes. Type 1 diabetes is usually controlled by taking insulin, and type 2 diabetes can be controlled by taking insulin or taking medications specifically to increase your body's reaction to insulin.